Alright, so this is task 6, and we're going to be doing this task on a stuffed animal patient so we can better explain and point out the different parameters, the physiology, stuff that we look at during anesthesia. The first thing we're going to start talking about, and we use the anesthesia sheet that we use here in hospital. It gives me my 4 major parameters that I like to look at, and then also has my O2 and my ISO. Again, the sheet we look at everything every 5 minutes, but even in between those 5-minute time periods, we're still monitoring and we're still listening, we're still looking, still getting a good idea of what's going on with the patient. So when I first come into a procedure, the first thing I want to do is I want to ensure that I have a good heart rate and I want to have good respiratory pattern. The reason the heart rate and respiratory pattern are important is because if they have a high heart rate, they could be a little bit light, which is not going to be good for a procedure. And if their respiratory rate is a little erratic, where it's not nice and steady, that could show that they're either having pain responses, they're too light, they're just not comfortable, they're not in a good plan of anesthesia. So that's the first thing that these are monitoring devices for. So I've attached my ECG leads. As I stated in the previous one, they're a mnemonic. I'm from the state of Michigan. I went to Michigan State for 2 years. So mine is green and white is always right. Christmas newspaper in the front and then Christmas in the rear. Some leads have an extra green line. Ours is just a 3-lead system, which works very well as well. I have a pulse oximeter, and so for this patient, since he doesn't have a tongue, we're going to use his ear just to demonstrate another place that we can use it. We could also use a toe. For our pulse ox, we like to keep everything above 95. Once we drop below 95, then we're looking at poor oxygen stats, which could increase which would be shown by bad circulation, not enough oxygen perfusion to all the rest of the body and all the rest of the tissues, which can cause issues under anesthesia as well with the isoflurane gas not getting to where it needs to go, and not a lot of carrying capacity. The next one that we want to look at is going to be our blood pressure. So I've attached our blood pressure cuff. This guy needed a size 5. I put it on the back leg. I find that the back leg is a pretty convenient place for the blood pressure cuff. So usually in the front legs we have catheters going on and just a lot of other things going on up front. Our blood pressure is going to tell us whether or not that our heart is working properly, if our tissues are getting enough blood to the tissues, and everything's functioning properly. For our blood pressure, if we have a MAPRS, the mean arterial pressure, below 60, we know that there's a problem. We like to keep all of our surgical patients on IV fluids. For a healthy patient, we like to do 5 mils per kg per hour. For a patient that might have a little bit of a situation, not feeling so well, dehydrated, such as a foreign body, we're probably going to keep them at a higher rate, sometimes 10 mils per kg per hour, and then we do that for the first hour. If they're doing well, we knock them down to a normal surgical maintenance rate of 5 mils per kg per hour. So with the blood pressure, we also want to make sure that we're checking our mucous membranes. Our mucous membranes is going to tell us whether or not that, or our cap refill time, it's going to show everything should be within less than 2 seconds. So if we have a delayed cap refill time, we can probably already know that our pressures might be a little bit low, and that could be from being dehydrated, that could be from being hypotensive, a whole list of things. So it's all a bigger picture here. So on our sheet, we like to know all of that information. We also take a temperature every 5 minutes. Temperature plays a huge role in whether or not a patient is doing well. The body temperature can mean perfusion. It can mean, hypertension. It can delay wake up in a patient, and it can also make the patient's immune system drop, which would delay healing as well. So we like to make sure that our patient's temperatures stay up. So for the second part, we're going to talk about the different physiological parameters and how they all kind of intertwine and what they mean together. So we're going to take a quick pause.